A wrist fracture is an injury where one or more bones of the wrist are broken. This is usually the result of some type of trauma, such as a fall. Wrist fractures are painful, but the pain reduces once the fracture is immobilized. This is done by splinting the fracture. Splints, rather than casts, are initially placed because they can account for swelling from the fracture. Once the swelling has gone down, a cast is placed. In some cases, a cast may be placed in the emergency department. This is usually done with very close consultation of an orthopedic surgeon. It is important to keep the fractured arm elevated above the level of your heart. It will help decrease swelling. Elevation is important for the first few days after the injury. Also, ice the area for the next 2 to 3 days. Apply an ice pack to the fractured wrist over a dry towel for 20 minutes several times a day. Depending on the type of fracture and the severity, surgery may be required. This may not always be determined in the emergency department. You will need to follow up with an orthopedic surgeon to determine what treatment options are best for you. Contact their office as soon as possible for an urgent appointment. Wear the splint until you see the orthopedic surgeon. If you feel the splint is too tight or is interfering with your circulation, you may loosen the splint. You may have been prescribed medications for pain. If so, take the medications as directed. These medications may make you drowsy, so avoid driving, operating heavy machinery, and drinking alcohol while taking them. At this time, it has been determined that it is safe for you to be discharged. There are some instances where complications may develop. Therefore, it is important to return to the emergency department for any of the following: increasing swelling, pain worsens or does not improve, fever, arm or hand becomes numb, tingly, cold, or weak, difficulty moving your fingers, your condition worsens, new symptoms develop.